Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about hypoglycemia, or low blood sugars, and the specific nutrients that might be helpful in managing blood sugar. Now, there is no substitute for a proper lifestyle, proper diet, right, and proper nutrient intake. However, these nutrients that I'm going to mention today are going to be helpful in managing or evening out the blood sugar throughout the day so you can feel better, okay? So the specific nutrients that's most important for hypoglycemia or low blood sugar, number one is adaptogens. Adaptogens help adrenal glands. So what we find in our office is that when people have low blood sugar, they often have adrenal issues, right? Because with low sugar, you're going to have increasing cortisol, insulin, and so forth. So you're going to have this kind of wild swing. And oftentimes they have adrenal dysfunction. So adaptogens can be very helpful in managing or helping hypoglycemic symptoms. So things like panax, ginseng, holy basil, rhodiola, different types of adaptogenic herbs have been known to help balance blood sugar for those people who have low blood sugar. Okay. Number two is general B vitamins and minerals. So like a good solid multi would be an example. However, don't just buy your typical off-the-shelf from like a CVS or a Walmart. Those are often poor quality and does not absorb very well. They tend to use the cheapest forms of B vitamins. Therefore, they can sell it at a low price. So if you go and buy calcium at some Costco, and the bottle is this big and it's only $10.99, there's a problem, right? Oftentimes it's just the lowest quality nutrient that they can find selling in bulk, right? So general B vitamins and minerals are very important for that. And then when you get into fibers such as pectins, guar gum, and then flaxseed are very important in terms of diversifying the gut. And also absorbing nutrients in the gut will help, or decreasing nutrients of like carbohydrates and so forth, right? Oftentimes people who have low blood sugar tend to eat like chocolate bars or something quick to get their energy up, all right? Plant sterols, found in vegetable nuts and seeds, right? However, you can get concentrated forms of this and it can help improve low blood sugar. Another one, branch chain amino acids. The three we're talking about is leucine, isoleucine, and valine. Now these are found in protein, basically, beef, chicken, seafood, and in dairy. However, with dairy, such as whey, like whey protein will have these amino acids in there. There are patients who are sensitive to whey, meaning they have symptoms, or they have bloating or GI issues and so forth. So I would sway you away from whey protein and get you more towards beef, chicken, and natural foods. And then maybe using some alternative vegetable type protein can be helpful, okay? Now, these nutrients can be found in many different nutrient stores or supplement companies. However, I would caution you against just buying them at a cheap price. It's important to get high quality nutrients. And that's why we developed an online store that's available for our patients. So what I would like to offer you guys is this. You can have access to my online store. However, you can't just buy whatever you want. What you need to do is contact me through either direct messaging or through the office, and we can set up an account for you. And we'll have to have a small 10-minute complimentary consult to determine whether we can allow you to buy our supplements or not, right? It really depends on each individual. And we don't like to just blanket it and say, these are all good. Because you may not have hypoglycemia, you might have something else. So it's very important to kind of distinguish that. Make sure that the right nutrients get into the right patient's hands rather than do a blanket supplement recommendation for anyone, right? So we are very precise with what we do. Many patients come from different parts of the country and different parts of our state to see us. And oftentimes they have bagfuls of supplements that they've been trying to help themselves with. However, it's not targeted to what they're needing, right? So sometimes doing small things can make big impacts, and sometimes taking a lot of supplements actually does nothing or can be detrimental to your health. So it's very important to distinguish between what your body needs versus what you think is good for you, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.